Meniscal degeneration is actually more common towards the old age. By definition, it is actually the over the chronic period of time due to overuse injury or due to associated with, especially in the case of ACL deficient knees, usually medial meniscus degenerates over the period of time. It leads to, the problem is there is actually structural integrity of the meniscus is lost. The synovial fluid acts like a one-way valve that it extrudes either into the substance of the meniscus or actually outside the just around the meniscus and gets collected before being actually absorbed. Therefore, this leads to classical cyst formation due to the meniscal degeneration, and these may lead to eventually meniscal cysts as well as the degenerative meniscal tears. Now, what happens is, if you see, there's always antecedent history of trauma, especially in the case of old age. There is maybe trivial history. The patient had some form of a trip or a fall on the knee, which was there was mild pain over 2-3 days. There was some form of swelling as well, which resolved over the period of time. And once that happened, then there was continuous kind of a crepitus and clicking and catching sensations from months to years as well. And patients, when you get their x-ray, usually show only the degenerative changes of the bone, may be absolutely normal for the case of the meniscus. But when you get an MRI, what you see is actually the fluid collection due to the synovial fluid, which is which is actually present in the meniscus. If you see, this is a sagittal view, an MRI as showing this is the one side of the meniscus. And if you see the medial meniscus, you can appreciate there is actually the fluid collection in the substance of the meniscus. There are two types of degeneration which leads to meniscal cyst. One is the perimeniscal and parameniscal cyst. Perimeniscal cysts are formed once the menisci have degenerated, and this leads to fluid collection inside the meniscus, for example, which can be appreciated over here. While there is a parameniscus in which there is actually the fluid collection around the meniscus. For example, classical example of this parameniscus cyst, which happens after the meniscal degeneration, is actually the Baker's cyst, and there may be associated with other injuries as well. There could be ACL or other injuries which may be present along with these meniscal tears and degenerative tears as well. So what is important is to how to actually, if this is another MRI, if you appreciate it over here, this is one of the meniscus which is clearly a triangular shape. It's actually showing exact triangle. But on the other hand, you can appreciate it's a degenerated weathered meniscus on one side, and there is some fluid collection around it as well. And this is kind of, which is actually showing a parameniscal cyst which is actually happened over the period of time. And if you go in an arthroscopic view, this is what you see. You can see the absolute degeneration of the meniscus as well as the loss of its architecture. Therefore, if this C shape is lost, it cannot actually expand under the compression forces or when applied for that. Therefore, it acts as kind of a acts as a body which can actually lead to locking and catching sensation over the period of time. Similarly, this kind of a meniscus cannot act as a force transmitter because it has lost its structural integrity as well. Therefore, usually these meniscal degeneration, which may be associated with tail trauma, eventually produce the symptoms of a chronic meniscal injury as well. Like, for example, there may be pain or swelling initially, along with the mechanical symptom of locking and catching, which may be present in the knee joint. When you get an X-ray, usually except arthritis with the knee joint, there is absolutely nothing over there. But when you get an MRI, you see these kind of pictures, and when you get an arthroscopy done, you can appreciate how much degeneration of the meniscus has actually taken place.